The Copenhagen Hip Adduction. This exercise has been shown to be very effective for training hip adductors. A 2015 systematic review published in the British Journal of Sports Medicine found that hip adductor strength was one of the most common risk factors for groin injury in sport. Performing the Copenhagen adductor exercise requires a partner to hold the trainee's knees and ankle, or the use of a high chair for support. The trainee is supported on the elbow in a side plank position. From this position, raise the pelvis and bring the lower leg slowly to the upper leg and back. The adductor muscles of both legs are active, but the higher load is on the upper leg, which supports most of the body weight. The lower leg has only to raise its own weight. The target muscles are the hip adductors. The adductors of the two legs are active, but the higher load is on the upper leg, which supports most of the body weight. The lower leg has only to raise its own weight. The lateral fibers of the external oblique muscles slightly flex the spine laterally, but serve more as spinal stabilizers. The Erector Spinae on the side facing the floor stabilizes the spine, and the Serratus Anterior protracts the scapula. The core muscles stabilize the spine. In this variation, the trainee elevates only the lower leg, while the upper leg remains static. In this variation, the focus is on the upper leg, which moves closer and then further away. The trainee places the ankle on the bench, and therefore this position is more suitable for advanced trainees. Placing the knee on the chair lowers the load. A variation with a lower load. The leg on the floor assists the trainee as it pushes against the floor and helps elevate the pelvis. In other words, the load on the hip adductors in the upper leg is lower, but at the same time, the lower leg's hip adductors also go into action.